Hi, this is Sarah Trott, and welcome back to the Fourth Trimester podcast. I'm really excited about our conversation today because I have two special guests who I will introduce in a moment. But today we're going to be talking about innovation in women's health and postpartum health and new resources, new information, things that can help you feel empowered and empowered in a way that allows you to take practical steps to give you and your family the information and the resources that you need. And I want to mention also that for many families, postpartum care, it can kind of feel like it drops off exactly when life starts to get kind of complicated. Like you get discharged from the hospital, you have your baby appointments, then some exhaustion, feeding questions, emotional adjustment stuff, all of this sort of sinks in, plus physical recovery, right? And then often what happens is you get this one standard 6-week checkup. And we know that the fourth trimester is not a single appointment. It's a major health and family and systems transition for everyone involved. So this is going to be part of what we talk about. And so today, my guests, I'm joined by Rachel Braun Scherl and Jodi Neuhauser, who are co-founders of 51 And. This is an organization focused on uniting women's voices and civic action to make healthcare work better for women. And they're going to share more about that, which I'm really excited to hear. So, as always, this is an educational and supportive conversation, but please check with your medical provider on what's best for you and your family. So, welcome to the program, Rachel and Jodi.
Great to be
Sarah,
here.
so excited to be here.
Yeah, we're thrilled. So, I just want to give you an opportunity to start by introducing yourselves in your own words. Jodi, why don't you go first?
Sure. So, Sarah, really excited to be here. I am a mom of two, who a 5-year-old and a 3-year-old. For me, the fourth trimester is very real, and it's still very new in my brain and in my body around this, ultimate crazy transition into motherhood and then into motherhood a second time without the systemic support. And that's part of what has driven the work that I've done in women's health. I'm a 4-time founder in the women's health space. I have founded companies in the fertility space. I help women and men get jobs in women's health. That's another one of my companies. And we've now just founded 51 and just launched it at the end of last year to really, like you said, unite our political and economic power to actually systemically change women's health and make some of these systemic changes in a way that also provides significant value to you as a woman as well. So we can talk more about that in a little.
Wonderful.
So I'm Rachel. I'm so happy. Jodi, I want to just be clear 51 And is Jodi's vision. She's the founder, CEO, and visionary. I'm lucky enough to be a co pilot as we try to commercialize it. I've spent my career building brands and businesses. And for the last 20 something years, very specifically in our broadest definition of women's health, helping companies figure out how to grow, how to build partnerships, how to find capital, how to sell assets, how to enter into partnerships, all those kinds of things. Wrote a book in the space, co-host a podcast in the space, co-teach a mini MBA with Jodi. And basically my shorthand is women's health all day, every day. And in the time that I've been in the space, I've focused on really two themes. One is we need to have the vocabulary to have a conversation that is meaningful and makes sense. And the second is if you want to build successful businesses, which many people are trying to do to deliver to folks in the fourth trimester, you have to understand the economics. We're in this part way because it's the right thing to do. But to really have an impact, with 51 and with all these other companies and to really help people be at the top of their game in their fourth trimester, we have to have revenue generating successful businesses as a foundation of our ecosystem.
Yeah, and I'm excited to hear some of those new companies that you think are definitely worth looking into as good resources for new parents. So I know it's hard to choose a favorite, but like you can you can share some that are just top of mind for you. And
So given the audience, one of them, and I'm in a very different stage. I have adult children who maybe soon will be taking care of me. But one of the sort of the theme for the companies that I'm the most interested in right now and that I'm working with are ones that fit into the standard of care and they don't add an extra burden for the healthcare practitioner. So one of the ones is Simply Fed, which I don't know how many of your listeners are familiar with, but basically the founder came up with almost a plug and play so that the obstetrician can provide his patient, the new mom, with access to lactation resources, it has a positive impact on the practice because you're connecting your patient to this resource. And then people who really know how to do that, who have the time to do it, who know how to get paid to do it, are able to give you the care, guidance, attention that you need. Because Jodi will talk about this in reimbursement, but with average appointments of 7 to 15 minutes, I don't care how fabulous your doctor is, he or she does not have the time to give you the care you need. And certainly, my experience was even less so postpartum. The big job is, you know, getting you successfully to deliver a healthy baby. And then there's just very little focus there. So the companies that are taking pieces, and there's another one that I'm just started working with in mental health and ways that you can anticipate who's going to have postpartum, um, and hopefully avoid it or maybe reduce the severity.
Yeah. Yeah, right. Because we know that Postpartum Support International states 1 in 5 moms and 1 in 10 dads experience postpartum depression. So, what does that tell us about the need to think about maternal mental health as core to the family infrastructure and as part of an ongoing conversation rather than just the one-time checkup?
Yeah, absolutely. And I think that, in some ways that actually starts with education. And I think that's where there's a lot of great companies and great podcasters like yourself and lots of others who are just doing a lot of work to raise awareness of, how you might be feeling in, postpartum and in this fourth trimester, sort of in this year or 2 year period after you have a baby. It's not some of those ways that you're feeling might not be normal, right? And really helping women understand that one that might be a signal or a flag, right? To ask for help or to go look for help, and then to make sure that people understand where those resources are. And I think it's our job as the system and at working within the system and building innovative companies in women's health to make sure that those companies and whether they're nonprofits or for profits have the resources and the commercial reimbursement structure to make sure that they can continue to provide those resources to as many people as possible.
Yeah. So, you mentioned the word reimbursement.
Yeah.
I
Ding,
want to
ding,
talk about
ding,
that.
lights go off.
Yeah.
Yeah.
Well, it's really critical because it's a concept that I've certainly learned a lot about from the two of you. So thank you. But I want to share more about it with everyone who's listening because it is important for both professionals and individuals to understand this
Hmm.
because there are a lot of services out there for people who can pay out of pocket and have that just be a decision that they make with no stress or about their finances. But for a lot of people, if their insurance isn't going to cover something, it's not going to be accessible. So, what do you want to share with us about reimbursement?
Yeah, I mean, I think one of the most important things for all of us, women and men in the healthcare system, to understand is how the business of the healthcare system actually works, and that's essentially what reimbursement is. So, reimbursement is the amount that your doctor gets paid in order to provide your care, and sometimes that's negotiated by the government, and sometimes that's negotiated by your insurance company. They're usually tied together in some way, shape, or form, and we won't bore everybody with how that actually all works and comes together.
But
But the
believe me,
the
we
thing
can.
Different, but we can if you're interested. But I think the key thing to remember here is that the way something is paid, so the way something is reimbursed back to your doctor, oftentimes, unfortunately, determines how and what kind and how long care can be delivered. And so, if we look at pregnancy care in the United States, up until literally, January 1st of 2027, things are changing, and I'll talk about that in just a second. But as of today, in the middle of June in 2026, as it has been for years past, pregnancy care is reimbursed in something called a bundled model. So whether you go see your doctor, 5 times or 15 times or 50 times, before you have your baby, that doctor and afterward, right? That doctor is going to be paid the same amount of money. So that's called bundled care. And what that does is it means one, that the doctor isn't actually paid for your care until after you deliver your baby. And so, they're delivering care for a 9 month period of time and hopefully, a year afterwards. And then they're not actually getting sort of the check or the reimbursement back until after you deliver. And so what is covered not only in the your pre-delivery care, but what's also covered in your post-delivery care is a huge part of how this reimbursement system is kind of set up and works. And so what we're moving towards at the beginning of January is something called an unbundled model, which will basically mean that your doctor is paid for every service that they provide for you, just like in other parts of healthcare. So you go in for your regular annual checkup, and the doctor gets paid for the things that they do in that annual checkup. It'll be the same for maternity care, and I think it'll be really interesting for us to see what happens and what this means for postpartum care. Certainly also combined with the fact that we had this big, beautiful bill that was passed last year in Congress. And unfortunately, there's a number of cuts to Medicaid in particular in that bill. And we're worried, a lot of us are worried that some of the extensions of postpartum care. So you used to only get that one 6 month or 6 week visit that was paid for. It's certainly in Medicaid care. In 49 states, that was actually extended over the course of the last couple of years to a year, where you can actually get, you can get postpartum care that's paid for by Medicaid up to a year. We're worried that that might be now rolled back with some of these Medicaid cuts. So that's one thing to kind of keep in mind for those who are receiving their care through some sort of Medicaid platform in their state. And it's important to realize that 40% of all births in the United States come through our Medicaid system. So we're talking about a really significant portion of the population here that could be pretty negatively impacted potentially by these rollbacks. But also, it'll be interesting to see how coverage or coverage changes for the postpartum period once these services get unbundled. And we are right in the middle of this right now. Everyone is trying to figure this out. We've got 6 months to figure out how it works. So I'll stop there and we can dive into any details as you're interested.
Yeah, for sure. Because prior to the 12-month extension, it was 60 days, right? It was like 2 months
Exactly.
with Medicaid,
Yeah.
right? And so
Yeah.
now it's
Yeah.
like, so now this is at risk. But so what as individuals, what can we do if there are people listening who are thinking maybe we are one of those 4 in 10 people, like what's an action or a takeaway from this that they can actually do to improve their own lives and their own experience?
Well, again, I think just understanding and what is recommended in terms of going back in and having those visits, and also realizing that if you're not feeling well, either mentally or physically, go back to your doctor. Right there, I think there's support there. There's support that exists through that Medicaid program, at least now, until those things get potentially rolled back, and it's going to be on a state by state basis. So it's going to depend on where you live, and unfortunately, a lot of our postpartum care, it depends on where you live in the United States, the quality of it, the access to it. And to me, that's a lot of the challenge from an equality perspective. It shouldn't Your postpartum care shouldn't be determined by where you live, in my opinion. And unfortunately right now it is. And so I would say just go to the doctor, get the care and the support that you need. And then if you're interested on the advocacy side, there's lots of organizations, including 51 and that you can get involved in to understand what might be happening in your state, how things might be affected or impacted in your state, and we can keep you posted on those developments.
One of the things that I think has also changed as Jody's talking is the conversation has gotten much more active. When you think about how many articles we see now, menstrual pain is not normal. We now discuss it as if it's not normal. It's not okay to have debilitating pain, from your period. It's not normal, meaning there's something medically that you should be concerned about if you're having terrible pain after you give birth. And one of the things that I think is so important in the growing conversation and the explosion in women's health is the permission to have those conversations. As Jody said, if you are in pain, the grin and bear it days are over. Women have been doing that for centuries. One of the things that I've become particularly interested in is really trying to quantify or look to the research that's quantifying how much money workplaces are wasting by not understanding what a postpartum woman might need, or what support she might need, or what benefits she might need. There's an economic incentive, and for businesses who are trying to survive, you need to be looking at the numbers. What happens if you do this right and you take care of your moms in their fourth trimester? And we're not talking about carry them around in padded cushions. We're talking about making basic workplace accommodations so they can be more productive when they're at work. Now we see, unfortunately, there have been a number of companies that announced that their postpartum benefits are getting less generous. But we have to really continue to push on the fact from the patient's perspective, if your body doesn't feel right, no one knows better than you. Do not be dissuaded from going to ask questions and pursue help. And the other piece is if you happen to be in an organization that where you have some pull potentially or would like to or believe that you can show the economic argument, companies are responding to that now because they want to make sure they're capturing how much money they're losing when women postpartum leave the workforce and don't come back. They're starting to track that in a real way, and that's real money. So I always go back to, if you're talking to someone who doesn't care about women's health because it's the right thing to do, that's fine. I mean, I'd like them to care about it, but show them the money, show them the numbers, because not doing this right, not caring for people in their fourth trimester is costing companies in absenteeism. And one of my favorite words that I use all the time now is presenteeism, which means I'm there, I'm at work, but I'm not really there. I'm not producing at my typical level. So those would be two places. Listen to your body and see if you can have an impact in your workplace with the economics.
Well, and I think, Sarah, that's also where we're getting a lot of amazing companies starting to work with employers. So using and this is, in both the Medicaid and the commercial markets, in using the employer channel. So providing benefits or working with employers to provide benefits to you in order to have these resources, right? If I think about somebody like, and I'm not sure Seven Starling is totally in with employers yet. Rachel, you may know better, but if there's lots of postpartum resources and companies out there. We can talk through a couple of them here if you're interested. But I think of companies like Seven Starling and Kabaya and Pomelo and, a lot of our amazing friends who are doing work on the pelvic floor side, right? With Origin and Ruth and Hinge. Like a bunch of these companies are really honing in on thinking about taking care of the mom in particular in a postpartum way, particularly on the mental health side and the pelvic floor side. So what Rachel's talking about is the resources are there for your companies to tap into to be able to provide them to you as benefits. And a lot of those benefits are driven by the demand that you can create as an employee of a company by going to ask your HR team members for for those benefits. We hear stories all the time from HR leaders who say, we added fertility care or we added menopause care or we added this pregnancy benefit because it was like we got so many requests for it from our employees that we couldn't ignore it.
Here's a particular example. So when Milk Stork started and their whole approach was giving you the resources and setting up the system so that you could pump while you're traveling and freeze your milk and send it back. So you have a whole system with everything is refrigerated and taken care of and transported. And when they started the business, it was direct to consumer, like so many businesses that started, in late 20 teens and early 2020s did. And what happened was the HR department started getting women walking into their office saying, my friend who works at fill in the blank gets this benefit when she travels. I need this if you want me back on the road traveling at this point in time. So that, to Jodi's point, there are real examples where, you march in and you can make a difference. The second piece is we're seeing a lot more reporting that people are either staying at companies because the benefits are good or leaving companies to go to companies where the benefits are better. We didn't hear about that for decades. But now, literally, folks are using it, companies are using it as a recruiting tool and they're using it as a retention tool. If you know you're going to need something or you're thinking in the future that you might want to have access to IVF or whatever your family planning needs are, you want to be at a company that supports that. And supports that means there's economic support. And not only are they supportive of the time off, but that there's financial support for that.
Yeah, we'll make sure we link to all of the companies that you've mentioned here so that our listeners can go check out all those companies and then email their HR team right away and say, these are
Yeah,
some
we should
things
just
that
make a list. So just
I would love.
send this PDF. Yeah.
Yeah, I would love these things. Yeah, and it's, the job market is sometimes, it fluctuates. Sometimes it's like in the job seeker's favor and sometimes it isn't. But don't let that discourage you from asking your current employer because you never know. There might be enough voices that come together and really make a change. So I love that advice and listen to your body, listen to yourself, self-trust. I love both of those messages. So thank you.
And you don't have to be the senior vice president or the CEO to have your voice be heard.
Right.
Absolutely.
There
Yes.
is some
Yeah.
strength in numbers.
Yeah. Yeah, absolutely. Or even just you might at any level, right? You might meet someone who's receptive and wants to have that conversation, who's also supportive and just needs that story to have someone else say, "Oh yeah, this was asked for." You mentioned mental health at the beginning, Rachel, and we know about maternity care deserts. These are real. March of Dimes reported more than a third of US counties are maternity care deserts, meaning they lack a birthing facility or obstetric care. So when I think about situations like that, I do think about mental health. I think about other kinds of support as well that new parents need. But this seems like a great opportunity for technology to help fill a gap.
Absolutely. And I think what we love about I'll jump in here, Rachel, and then you jump in. I think what I love about the mental health side of things is I think it's a conversation that is starting to change. I think certainly as the millennial generation and generations sort of behind us come more prominently up the food chain in corporations in particular, and just in society and culture, I think having more people talk about their challenges with mental health, whether it's athletes or celebrities, it sort of starts to break down that taboo. And then I think same when we have athletes or celebrities or other prominent folks who are talking about their own struggles in the fourth trimester, right? As parents, what they went through, it really just normalizes it. It helps go, there's not something wrong with me. There are, remember that there are hundreds of thousands of hormonal changes in your body that are happening pretty much every second for a 2-year period postpartum. And so, that is, it's only natural to understand that there might be some mental health challenges there. And there's nothing wrong with you. It's not, you haven't done anything wrong. And I think reaching out to get that mental health support is so key. And I want everyone to know if this is something that you are struggling with or struggled with, just on the policy side, there are so many resources here people are fighting for you in Washington at the state level. There's the Maternal Mental Health Alliance, which is actually a coalition of a bunch of organizations that have come together to fight for more postpartum depression and maternal mental health funding and resources. The CDC has a big resource that they put out. I think it's called something about the Her campaign or Hear Her campaign. The fact that it is a required screening at that 6-week postpartum visit is another policy issue there. And there's a couple of key candidates that are actually running right now for Congress in the midterms who have been very intimately involved actually in this work. So if we can get them involved and into Congress, we will have even more champions to help us move some of these resources forward.
And I would say we talk about allyship all the time. This doesn't just have to be about women. What happened during COVID and with, famous people like Michael Phelps talking about mental health, the conversation becomes much more comfortable and culturally destigmatized. So we've come a long way in our ability to talk about mental health. It was not at all driven by what women in postpartum are experiencing, but we can take advantage of the fact that culturally we are much more comfortable talking about that. So I give a lot of, we hear this in menopause also, but kudos to celebrities who are high performers and high achievers who say, you know what, I've accomplished this and I struggle with those things. I also think that the awareness of mental health increased a lot in COVID because there were just so many people in difficult situations, either difficult financial situations, difficult health situations, having no childcare. And so I like to always think in women's health, let's take advantage or capitalize on the trends that are moving, even if they're not driven from our space. That's okay. We can still be the beneficiaries. And I do believe that's part of what's happening in the mental health conversation as it relates to women's health. You know, we see all these statistics. We know women over index for depression and anxiety. Let's let's figure out how to have the rest of the conversation really help us make change in the things that affect women in such an overwhelming way.
Yeah, and the other thing I like about the as this conversation opens up is just the mode of delivery of care is actually starting to match the cultural usage of that care. If you think about a lot of maternal mental health care can actually be delivered via telemedicine, and so and having these conversations with a licensed therapist or a licensed practitioner, a lot of that can not all of it, right, but a lot of it can actually happen over a phone, and I think it can allow us to then reach into a lot of these maternity care deserts and still provide some really important postpartum mental health care in a way that is, doesn't require someone to drive 30, 45, 50 minutes or more. I mean, my family lives in South Dakota and the closest OBGYN is 2.5 hours away. And so, for them to be able to get postpartum care that they can just sign on to their computer and have a session, has been really helpful for people who live out on the farm where my family's from.
Yes. That is such a great point that we now have access in a way we didn't before, thank you to technology.
Yeah.
And
And cultural comfort level.
Yeah.
yeah, yeah, and you don't need to have depression or anxiety or any kind of diagnosis to benefit from mental health care as self-care, by the way.
Exactly.
It's worth
Yeah,
mentioning that as part of the conversation.
Well, you're preaching to the
absolutely. This
choir. I
is
mean, we know that so much of the conversation is, especially for people in the fourth trimester, it's not just one thing. It's not just your body. It's not just your mind. It's not just whatever weight you want to be at. It's everything. And mental health, we are smart enough to know that you cannot separate mental health from the rest of what's going on with you, not just postpartum, but over the course of your life.
Yeah, and
Yeah,
I think, Sarah, this is another one of these things is in the same realm of, I would say, pelvic floor physical therapy, right? To me, this is another one where we are starting to finally crack through that taboo of people talking about, what is your pelvic floor? What is it for? Right? How damaged did it get in birth? What does that mean for me moving forward? And wow, there are actually resources for me to go after kind of fixing some of my the damage that may have occurred to your pelvic floor during birth. And so I would say that one is farther behind probably the mental health conversation, but I'd be remiss to not mention it here in the effort to continue to boost awareness and the conversation around pelvic floor health as well.
do you have any favorite resources or just maybe resources worth investigating for people to mention for either of those, for mental health and for pelvic floor?
I will have to let me check with our 51 team and see if we have an action guide on pelvic floor. I don't know if we do off the top of my head, but we have our friends Kareen Karmi and others over at Origin in particular are doing some great work on increasing access for pelvic floor for those who have pelvic floor challenges postpartum. We can also, Sarah, send you a couple of other resources here because I know there are a couple of also telemedicine companies that are also doing and putting together programs to help you with your pelvic floor health postpartum in a way that you don't have to actually go into an office. I don't have the names of those off the top of my head, but remind me and we'll get them over to you for your listeners. But it is definitely a conversation. One of the things we are doing in particular at 51 and is part of the beta program that we're building right now and we'll be able to launch soon, hopefully end of the summer, is an opportunity for people to essentially drop in your summary of benefits from your insurance company. And I always use pelvic floor health as an example here because a lot of people, what they don't understand is what kind of coverage do you have? And what we're doing is building a layer that interprets your summary of benefits with kind of that women's health layer over top of it based on what you tell us about what's happening with you. So if you tell us that you just had a child, we can add that sort of pelvic floor physical therapy layer over top of it. But I just ran mine last week in our beta testing. It was 105 pages that I dumped into our platform. Turns out I have 60 pelvic or 60 physical therapy visits that's covered, and then being able to then help use that to educate women on. Did you know that you can use those for pelvic floor physical therapy, and here's what pelvic floor physical therapy is, and here's how to talk to your doctor about it, right? Here's how to schedule an appointment with the doctor and have that conversation to see if it's something that might make sense for you based on what's happening in your body postpartum. So stay tuned to that coming from 51 and hopefully by the end of the summer.
Love that so much because we don't realize that you have all those visits. We do have great, dense information packets that we get from insurance providers
Who
that,
reads
you know,
105 pages,
I
right?
mean,
Yeah.
usually, like, there's like a PDF or a PowerPoint that you get that you can sort of skim through of 20 pages to pick the benefit. I feel like that's a
Yeah.
thing that most people are kind of looking through, but the actual like long form, I don't know who's reading that. So what a masterstroke. What a great
And it's
tool.
Yeah.
even more ironic when you think about it. You know, Jodi's kids are, out of diapers, at least at this point, and sleeping through the night. Who's reading that 105-page document? I mean, just the idea that as you're trying to figure out how to take care of your family, that now in order to do that, if you had 7 free hours and a law degree, you maybe could figure out what the plan said, which is why this tool that we're building is so useful because I don't care how old your kids are, how much time you have. No one's doing that. Those are not designed to be clear and easy to understand and for you to access, the maximum number of benefits you can. In fact, I don't know if anyone would admit it, but it's probably designed to do just the opposite.
Yeah.
Well,
Yeah.
and to your earlier point about how it's different in every state, like there's so many different versions of insurance plans. It's not like we can collectively like grasp anyone like the blueprint or the rule book or the playbook of how these things work because they're all so different. We had a
Yeah.
great attorney on the program a little while back, and I can link to her episode too. And we talked about maximizing maternity leave benefits. Maternity leave
Mm.
being like a misnomer, like there's no such thing as like disability, but in state by state, like it is so different. So you have to sort of cobble together like this kind of leave and that kind of leave. And actually there's to the same kind of echoing that same sentiment. Like there's actually more that you have access to than you even realize if you know kind of what the different kinds of leave are and how to invoke them and how to stack
Mhm.
them for yourself and make the most of it.
It's about understanding the system, right? I think, what women's healthcare is, it is a system, and it is a system that has been, designed by men mostly. A friend of mine who used to run coverage for CMS, which is the organization or the government department that sets coverage for insurance. She always talks about how the statute that set up our healthcare system, essentially, certainly for Medicare and Medicaid, was written by a bunch of white guys in 1965. And so, they certainly weren't thinking about things like menopause or postpartum or any of these other, pieces of our healthcare system that just for so long have just been, not even thought of, and not just underserved, but also underfunded, but also just not on the radar screen. And so I think that's what we're doing a good job of as an ecosystem now, and as women, and as this generation, these multiple generations coming together to go, hey, there's something here that we need to bring to the forefront.
Yeah. Yeah. That's such a good point. It's time for a little refresh, isn't it?
A
It
little.
is. I mean,
Whew.
I think there's an interesting, and this is not completely postpartum related, but certainly broader women's health related. Like, what also a lot of people don't realize is insurance companies have no idea how much they spend on women's health. And I think that's really surprising to people when you talk to them about that, because the way that the data is collected and the way that the data is labeled in insurance companies and in claims data, there's not just like a button like sort for women's health. Like, it doesn't work that way. They can kind of figure out what they're spending on fertility because those things are kind of bucketed together. They have a good idea of what they spend on pregnancy, like, I would say delivery and the pregnancy period. That period is the postpartum period, certainly is not, I would say, tagged in the right way from an actuarial standpoint. And so, well, part of the work that we're doing with 51 and is working with building a women's health data collective to help insurance companies understand how much are they actually spending on women's health, because a lot of the spend on women's health and the spend on postpartum is actually hidden in other parts of their data. So, for example, we know that 80% of autoimmune conditions happen in women, but that's not labeled as women's health spend, that's labeled as autoimmune spend. So when one of these companies comes to an insurance company and says, "Hey, we really want you to cover this innovation, this service, this device, this digital health platform for postpartum or for women's health more generally," the insurance company turns around and says, "Well, we don't spend that much money on that. That's not a problem for us." And it's really about how the data is organized. And so, you think about some of these big systemic challenges, just literally how data is labeled in claims and insurance companies. These are some of the big moves that we have to make in order to unlock a lot of the innovation that's out there.
And I just want to reinforce what Jodi just said. Again, it goes back to the data. If you are not looking at a number that's terrifying, you're not looking at the entirety of women's health. So for companies who are looking at benefits, there could be a whole lot of things, reasons, and physician visits that women are having that relate to being, 2, 12, 16 weeks postpartum. But if they're not labeled in a way that makes sense. Like, let's say you've gone to an orthopedist. Let's say you've gone to a pelvic floor therapist. Let's say you've gone to some other specialist. It doesn't show up. So what employers are doing is underestimating the impact of not understanding what it takes to treat some of these conditions that you experience after you have a baby that might not be gone after 2 weeks. They might last 2 years. Who knows? I mean, it's I remember speaking to an obstetrician. Well, I speak to many obstetricians, but one who said to me that what your body goes through, it's hard for people to explain or understand who haven't done it or aren't in the medical field, what a woman's body goes through in the act of giving birth. And there's so many systems that are affected, and often our focus is really, as Jodi pointed out, just too narrow and doesn't include the entirety. Mental health is also not categorized as women's health, which is a huge issue. And we all know that when it's diagnosed early, whether it's postpartum or otherwise, it's easier to treat and often leads to less severe symptoms. So again, the money matters, the vocabulary matters.
Yeah.
Yeah, I think
And thank goodness for
so.
capitalism, right? Because like earlier you're saying, like you're making the case. You're making the case with data, you're making the case with the money story around, hey, if your women drop out of the workforce because they're like absentee or presentee, and like that term,
Yeah.
right? If you're experiencing that with what 50% of your workforce,
Right.
51%, right? Like that's significant, right? That's real money and that's real business.
And it is real money. And just because it's not being collected the right way doesn't mean it's still not having a huge financial and productivity impact on companies.
And Sarah, I think this is a good point to also talk about the challenges in women's health research and what that actually means in real life. And I think, we talk a lot about how we need to understand a lot more about women's health research. We know that women weren't included in clinical trials until 1993. We have a significant underfunding gap when it comes to understanding, how conditions uniquely or disproportionately or differently impact women. I will also say that that also transitions again back to this idea of data and on the claims and on the business side of things too. It's not just a challenge in the lab. And one of the things I'll flag for your listeners who are in that postpartum period is watch your life insurance premiums. Because part of what a lot of times what we see, and this is what we advocate for when we talk to women who are pregnant now, is go get the life insurance now before you give birth that you think you might need after you give birth. So if you want $1 million or $3 million or whatever the coverage is, you need to go get that now while you're pregnant or, even frankly, before you get pregnant. Because what we have seen anecdotally, and we don't have enough of the research to study this, but to kind of really dig into this, it needs to be studied. But what we've seen anecdotally are women who give birth who do identify as having symptoms of postpartum depression and do actually, check that right on their 6 week checkup. That data then filters down into their electronic medical records, which then filters down into the databases that insurance companies and life insurance companies are using to make life insurance coverage decisions and recommendations. And so we have seen, just again, anecdotally, we have, I would say, not hundreds, but multiples of tens of stories where women have either had their life insurance premium canceled after they said that, hey, I'm struggling with postpartum depression, or they have had their life insurance premium go up significantly because it was an event that something changed in their health. And so it is something that we're looking into at 51, and we're looking into sort of why this is happening. My gut tells me that it's something to do with the actuarial tables that life insurance companies are using, and there isn't data that distinguishes postpartum depression from kind of just the general depression tables potentially, right? And so, and I think these are all things that we need to dig into. But I think, a real actionable step I would say for any listeners who are here is, get that life insurance locked in earlier on as a part of your kind of family planning process, just in case.
There's so much there. We have episodes where we've talked to financial planners who talk about the importance of kind of your legalities and your financial picture when you're starting a family and thinking
Hmm.
about starting one. So having that life insurance policy is so important generally. The other thing that comes to mind is this is why sometimes people are afraid to tell the truth on these
Yeah.
forms. I mean, there are other reasons why people are afraid to tell the truth. They think like that's someone's gonna. I mean, I'm not going to say the fear things because I don't think that's helpful for people.
Yeah.
But there are other things, right? And so I just wonder, are there better ways to screen? Maybe I don't know. I love your point that like this is another opportunity. Whenever I talk with you, I get so fired up about all the opportunities that are out there, right? For people to make change and create better ways of doing things and better
Yeah.
outcomes
So
for families.
I will say, if anybody who's listening is in the life insurance industry or space and wants to help us figure this out or tackle this, reach out to Sarah or to myself or to Rachel, and we might put you to work on the side of your everyday job, because it's not something Rachel or I have a lot of experience with, but we know that this is happening, and so we're starting to figure out where we're starting to understand how can we figure out what the systemic challenges are there.
And I do think going on that insurance, not necessarily life insurance, to the companies who are using or are thinking about using benefits as a recruiting and retention policy, I think that's a really important way to differentiate. And, gone are the days where you go to a company and stay there for 20 years. I think the average length of stay in a job now is, 2 to 4 years, and, in the people in childbearing ages. So the having reasons to create loyalty could have amazing business benefits as well. And I think, one of the things you said earlier and that we had in our discussions before we got on the call is all of these topics that we're talking about, women aren't talking about. We might be getting better about talking about infertility or trouble getting pregnant, but sort of the day-to-day hard stuff that isn't the big stuff is what often trips people up in the fourth trimester and in life, not knowing what the next step is, not knowing what you need to do if you're having terrible indigestion, but someone else might know. I recently was connected to a company, and I'm not going to share the name because it's so new to me that I want to do some more research. That basically what they're doing is they're doing social listening and taking all of the publicly available population health data and integrating and summarizing what people are saying that might not have been coming through a clinical trial, but that lots of people say when they're on this particular chemo drug, this is what they've done to reduce their nausea. Now, their doctor might not be recommending that, and I'm not suggesting that people ignore their doctors, but the idea of how important the individual conversations are, Jodi and I talk a lot about big systemic issues, but as you were talking about sort of the people who listen to this, you are having personal conversations with your friends, and don't discount the value of that. Someone else's experience um, really might have huge applicability to you. And so, as this company gets more developed, it's just another way to think about or hear about or learn about potential treatment options or symptom reduction choices that you might have.
Yeah. I really like that because you're highlighting the value of the individual voices coming together and how that might be a great way to discover new things to research, new solutions. So I really like that. And I would also caution against like just doing whatever someone on social media says. Like I think that's really particularly not great
Incredibly
in the space
dangerous and concerning to HCPs, to healthcare
yeah,
practitioners all the time.
of being postpartum. Yeah, there are a lot of really great mom apps out there that I really like for social reasons because isolation is a thing that happens. Like when you're at home with a new baby and you're used to being at work or out, or and it feels and isolation is a driving factor also for PMADs. But the other piece of it is kind of a double-edged sword is like I've seen on those apps like people giving each other medical advice, and
Which
that's
is
where
dangerous.
I'm going to be like loud about cautioning against that. Like talk to your doctor, talk to your nurse practitioner, talk to someone.
100%. Do not take medical advice from anybody who isn't a medical health professional. I get nervous about this all the time with social media, and there are all this conversation about what should we believe, what shouldn't we believe. I mean, as a starting point, someone who's just sharing their personal experience is not a healthcare professional. And they what they're saying might be relevant to them, but not relevant to you. I'm just thinking of one example. You said things that are timeless. I will never forget when I had a baby who's now a grown up, that as soon as someone told me that I had to use these incontinence pads to change her so that the changing table and all the laundry didn't get demolished in one big blowout, literally, it was like a $6 solution that was life-changing. Like, I never would have thought to use an incontinence pad. I'll just be doing laundry, for the rest of my natural life 3 times a day.
These are the suggestions you can take from social media, you guys, right?
Exactly.
Like putting multiple sheets on your bed. I think the normalization for me, Sarah, when you were talking about it, it was nobody told me and made it normal that feeding was hard. Right. And so when I went through the process of trying to breastfeed both of my kids, as a type A, hard charging career woman, I was like, what is wrong with me that I can't like make this work? And then, you start to quietly share that amongst your friend group. And turns out everybody had trouble, like,
Right. But no one's
feeding or
shouting it from the
making that happen.
rooftops because they feel
Yeah.
somehow that that's admitting defeat of something.
Yeah. Yep.
Yeah.
Yeah. No, absolutely.
Well, asking for help is a strength, not a weakness. And almost we've had hundreds of perinatal professionals on this program. We've had doctors and nurses and like PhDs of all kinds. So what's kind of very common in a lot of these conversations for those, and most of them are parents, so they'll tell their own fourth trimester experiences. They all kind of echo the same thing, which is like, oh, I thought because I work with this every day, that when I had a baby, I'd have it all figured out and it wouldn't be that hard. And they all turn around and say, actually, it was really hard. And I speak to parents totally differently now as a professional after becoming a parent myself. So it's not just you, everyone. This is like something that is hard for everybody.
And I think that's a bigger women's health too. It's not just a fourth trimester thing. I would say Rachel and I have been working in this space for 15 years. And then, when we have our own health issues, we're like, wait, how did I not know that? Or why did I think that was normal? And so, again, it extends not just to this period of your life, but as you guys come out of the fourth trimester and come out of working with those who are coming out of the fourth trimester, it does extend on into women's health too in the broader arena.
Yeah, agreed. Yeah, because it's like no one person can know everything. Like even the doctor who's been practicing for decades, like they can't know everything about every obscure disease that's out there, which is kind of cool that they have AI tools now to kind of help listen. But I know I've talked to doctors about using AI and how they're like, well, we really like it for some of that stuff, but I usually just kind of look at it as like a way to double check, like maybe it'll say something I didn't think of, but I'm not using it to direct my medicine. I'm not, and they also feel strongly about like residents not using it. They still want them to like do their notes by hand and learn the groundwork, and I think that's applicable for like lots of different professions, not just medicine,
And then
actually.
add
Yeah.
to that that patients are coming in with reams of data from their wearables, and there's no easy way in many cases in women's health and in other areas for the doctor to absorb it in enough time to speak intelligently about it, or even whether or not he or she believes the validity of the data coming out of it.
Yeah.
Yeah,
Yeah, Jodi,
absolutely.
didn't you just send something around about that? Around like, oh, I've got my watch and my sleep ring and on my cycle tracker and all this thing, but like what? So what? What's happening?
Yeah, it's actually how I got into women's health even, 13 years ago, back in 2013, I was like, "What do I do with all this data and how do I put it together?" And that's really what drew me to this industry and figuring out, how do women continue to sit at the center of having to figure all of that out, right? We have to navigate our own care, we have to navigate our kids' care, we have to navigate sometimes our partner's care, and our parents' care. And so we really are that kind of central healthcare navigator that sits at the center for sure.
Yeah. Well, I
Yeah.
want to invite you to share more about 51 and
Yeah, we started 51 and because we realized that there is a lot of we're sitting on a lot of political and economic power in the United States here with women and allies of women who know that the healthcare system can be better. So we started this by really looking at, what is influencing Washington to move the needle on things. And unfortunately, it is a capitalist society, and you do have to bring capital to the table. And we did an initial very, very small study and looked at the amount of lobbying that was being spent in healthcare, which is about $558 million. And we found that less than 2 million of that was going towards anything related to women's health. And so, we're really not sort of showing up at the table with the both political and economic capital that we have collectively. Because I think oftentimes women get pitted each against each other as, well, you have this belief about this part of women's healthcare and you have this belief about this part of women's healthcare, but actually we all go through the same healthcare system, which is challenged for all of us, right? We're all going to go through menopause. We're all, a lot of us are going to go through pregnancy. A lot of people are going to go through a fertility journey, regardless of where you live, your geography, your economic background, your political background. We're all facing the same system. And so if we all come together, we sort of put aside our differences in different parts of women's health and we come together to fix the system, we have a lot of political power to do that. So 51 and is a membership based model. It's $100 a year, and you get a lot of benefits, amazing benefits like these tools that we're building. We have a lot of events that we do with evidence-based doctors and influencers who are coming to help us, just teach and learn each other. And then there's $1,200 in discounts on products and services in and across the women's health space. Again, we mentioned a number of these tools, but the most exciting thing is we actually take your $100 and that capital and we reinvest it back in actually fixing the system. So right now we're working on 5 priorities on women's health reimbursement, and one of them is around getting better reimbursement for people who help us during pregnancy and in the postpartum period. So how do we make sure that lactation consultants, that community health workers, that doulas, that midwives are able to both do everything they're licensed to do, and also get paid well to be able to do that so that we can extend some of those care providers into some of these maternal health deserts. So that's literally how we're pooling the capital in the economic side and putting it back into actually fixing the system while providing a lot of value for you as members at the same time. So we'd love for anybody to join us and check us out at 51and.com.
yes, and we'll put a link to that as well. I think I'll have my own referral link, so please use it
Yeah.
and support the program, support fourth trimester if you enjoy the show. And so thank you again, Jodi. Rachel, do you have any final thoughts that you want to share with listeners?
One of the other benefits of 51 and that we've seen is very similar to what you're trying to create with the conversation. People really like being in a community, whether it's 51 and, which we hope it is, or another one where you're talking about things and challenges and situations and concerns that you share with a lot of other people. And just like the focus of what you're talking about and 51 and includes what you're talking about as well as many other issues, there is a lot of benefit that we're seeing in being part of this discussion, in being in a community where people value and consider important, women's health and how to make it better.
Thank you. Thank you so much for the work you're doing. I'm a member of 51 and I'm a huge fan. I just support the work that you're doing. And I hope lots of other people join as well. Thank you so much again.
Thank you. Thanks so much, Sarah. Thanks for the opportunity.
Thank you. Thanks for having us.